You must be the barrier.
Honorable members, when we suspended for lunch, we were debating a compendium of budget bills. Honorable member for Tall Pines, I assume you're ready to begin. The chair recognizes the honorable member for Tall Pines.
Thank you so much, Mr. Deputy, and good afternoon to everyone in the chamber and those who are listening to me by radio. Today, I rise in this honorable house as the Member of Parliament for the great people of Tall Pines and as the country's Minister of Health to make my contribution to this year's budget. Expanding Opportunities Island by Island is the title. In fact, if I was not a humble man, Mr. Deputy, I would think that the Minister of Finance named this year's budget with my ministry in mind. I say that because at the onset of my tenure as Minister, I've been very deliberate in elevating equity and opportunity across the country when it comes to healthcare systems. Nevertheless, I rise with a deep sense of responsibility as I remain committed to the advancement of my constituents, the development of our country, and the transformation of our public healthcare system. Over the last year, a lot of work has been done in Tall Pines, inclusive of road paving, road patching, thanks to the member of South and Central Eleuthera. Mr. Deputy Speaker, I'm pleased to report that the repairs at Jubilee Park has begun, and the refurbishment that was scheduled to be completed in the last budget cycle is now at the top priority for the Ministry of Youth, Sports and Culture. And I was assured that work would begin early in this budget cycle. I extend my apologies to the residents of Jubilee and assure them that the pool and basketball court would be completed before the end of the summer. The property to the left of the entrance to Victoria Gardens that was home for a scrap metal operation and burned down a few months ago was finally acquired by the government and currently vested in the Ministry of Housing. It was a vexing issue for the residents, and I was back and forth with the owner of that establishment and the Ministry of Environment about the derelict vehicles at the entrance of that residential community. I want to thank the residents of Victoria Gardens for their patience and the member for Golden Isles for assisting me with the cleanup and working closely with me to eliminate the rodent problem that is spilling over in my constituency as a result of the landfill. Rosinicides were used, and I'm pleased to report that the adult rat population is now lower, and he has brought some relief to the constituents just east of the landfill. Mr. Deputy Speaker, all areas of indiscriminate dumping in Tall Pines have been addressed, particularly off Gladstone Road and some additional pockets of Ballard Road east. Cleanups are carried out on a regular basis, inclusive of the verges in my constituency not covered under the Beach and Parks Authority contractual arrangements. The flooding at the roundabout of the Fire Trail Road and Somaila Butler Highway was fixed by the Ministry of Works, and Ballard Road West, the main road entering Jubilee Gardens, were also paved, and the drain cleaning in my constituency has started as we prepare for the hurricane season. The Tall Pines Unemployment Program is gaining momentum. Our BJC and BGCSE after-school classes at the Garvin Times Primary is going extremely well and is one of the success stories in my constituency. We are finalizing our church partnership program for community-based projects, and to date, more than 12 ministries are in the Tall Pines constituency, helping with the disabled, the shut-ins, assisting in feeding programs, providing Christian counseling, and social support. A few months ago, the Tall Pines Urban Renewal Center was open, and it is already making a great impact in the community. I want to thank Mr. Stephen Dean and both Ministers Bell and Ramming for their support. I'm happy to see that additional funding is allocated in the urban renewal budget this year 4 urban renewal centers. Yes, sir. Mr. Deputy Speaker, Tall Pines door-to-door campaign continues, and I want to thank the residents for their warm welcome, giving sound advice and their constructive criticisms on both national and community issues. A few weeks ago, we held a successful Mother's Day door-to-door giveaway that was well received, and I was overjoyed to connect with mothers in the constituency and bring a few words of encouragement. Last Saturday, we had a great turnout to our Father's Day grill out, and this year we incorporated health screening for fathers and sons, inclusive of nutritional education and other wellness tips. Next month, we will honor all our graduates in Tall Pines, and my team have already started planning for our mega back-to-school extravaganza. The Tall Pines Pantry remains open for constituents who need food assistance. The last 4 years have been a wonderful experience, and I want to thank the Tall Pines residents for their ongoing support. Please stop by the headquarters anytime from 9 to 5, Monday to Friday, at the corner of Fate Avenue and Ballard Road. We need to hear from you. Mr. Deputy, in 1 Corinthians chapter 15, verses 58, the Word of God offers timely encouragement with the following inspired words. Always give yourself fully to the work of the Lord, because you know that your labor of love will not be in vain. It is with this assurance and by His unwavering grace that I remain humble and grateful to serve my constituents and the general public with professionalism and acts of kindness. Mr. Deputy, the truth of the matter is anyone who in public office understands that the full support of the community is necessary to be an effective and productive member of Parliament. Over the last 4 years, I have enjoyed the opportunity to build wonderful, lifelong relationships. My team and I have created opportunities in the constituency, assisted residents in difficult times, and ultimately touched lives and improved livelihoods. Mr. Deputy, I now turn my attention to the national budget. Mr. Deputy, a few months ago, in the midterm budget, I presented to this honorable House a snapshot of what we were doing in the Ministry of Health and Wellness. We spoke about areas of infrastructural upgrade, union agreements, recruitment and teaching, hospital and clinics development, digitization, legislative reform. We spoke about our journey to universal health care coverage by way of national health insurance. But before I present the expanded opportunities in health, island by island, I wish to say that I'm privileged to serve in this progressive administration under the compassionate leadership of our Honorable Prime Minister, a man who continued to walk with global leaders but never lost the common touch. He is hardworking, accessible to the small man, and possessed the mental acuity to solve complex challenges that face our nation. Together as a team, we remain focused on our commitments outlined in our blueprint for change to recover, rebuild, revitalize every sector of our country. Mr. Deputy, as we wind down this budget debate, many of my colleagues have already shared the good news about their respective ministries. The healthy growth of our local economy and the fact that we are presenting a balanced budget with a projected surplus for the first time in a modern Bahamas. It's a great accomplishment by our Prime Minister and the entire team at the Ministry of Finance. I'm proud of this budget. I support this budget 100%, and I'm satisfied that my ministry will have the resources necessary to improve healthcare services for Bahamians at our hospitals and our clinics across the country. We must not let the members opposite and their pundits try to deflect and downplay this administration accomplishment. God has been good to us. Amen. I want to say that again. God has been good to us, and likewise, we have been good stewards of the public purse. The economy has rebounded under the watch, our watch, and after a dark period under the former administration, we have turned the corner and the future looks brighter. When the Prime Minister invited me to serve as the Minister of Health and Wellness, I knew the weight of this 24-hour responsibility. I knew that there would be fires burning in health, and that many of them were deep-rooted, complex, with no quick fix. I knew that much of the issues concerning our hospitals, clinics, manpower deficiencies, and patient access to care would require comprehensive assessment, planning, and a very robust execution strategy. And finally, I also knew that a significant portion of what I was called to do will not happen overnight, that it would take a lot of time, that some of my accomplishments as minister will dawn in the latter part of our term in office. The reality is, we need a second term in office. Under the leadership of the member for Cat Island, Rumpke, and San Salvador, to continue the heavy lifting and good work for all Bahamians to secure the bright future for generations to come. Yes. Mr. Deputy, my ministry covers diverse areas with many pressing needs and unique challenges. Oversee 80+ clinics across the country, 2 mini hospitals, 2 major public hospitals in New Providence, and 1 in Grand Bahama, with just under 8,000 employees under our remit. This year's budgetary allocation is a reflection of the population growth and the diverse medical needs for Bahamians across the archipelago. This year's budget, total draft expenditure estimates for Head 60, the Ministry of Health and Wellness, and Head 66, the Department of Public Health, is pegged just over $416 million, with $355 million for my ministry and just over $60 million for the Department of Public Health. These allocation reflects the largest estimated expenditure sum for any ministry other than the Ministry of Finance. These increased sums clearly demonstrate our administration's commitment to improving health services across the country. So when we compare the estimate expenditure for last year's budget allocation, we see that the Ministry of Health and Wellness received an increase of some $22 million, whereas the Department of Public Health received an increase of $7.6 million. A similar picture is seen with the estimated capital expenditure, with $38.5 million allocated for this year's budget and reflect $13.3 million increase from last year. This figure does not reflect the $75 million PHA loan facility from CIBC for the Freeport Health campus and the PHA renovations, and very soon we will see added to this amount the multi-million-dollar funding by way of an SPV for the new hospital for New Providence. Mr. Deputy, the crisis we met in our healthcare system did not happen overnight. It was a direct and shameful consequences of unintentional neglect and, in some instances, reckless political selfishness from the former F&M administration. What we met was a crumbling healthcare system. The Princess Margaret Hospital was barely standing, with little or no financial injection in that aging infrastructure in the F&M's last term in office. And what was most heartbreaking was the blatant disregard for our Family Island clinics. Clinics were operating without the basic requirements and manpower resources. Many were unfit for staff and patient care, deficient of lab and diagnostic equipment to support our medical teams in remote areas, reducing many of our Family Island clinics to a mere referral service. Mr. Deputy Speaker, as our administration moves to strategically build our economy, we reduce VAT from 12% to 10%. For toiletries, feminine products, baby products, food items, medicine, VAT was further reduced to 5%. We increased the minimum wage and currently working on a livable wage. We opened the economy through proven, innovative projects and strategies. Unemployment numbers are at an all-time low in the single digit, with expanding opportunities for Bahamians everywhere are steadily becoming a reality, not only in the capital, but island by island. Mr. Deputy, a strong economy and a strong healthcare service goes hand in hand. It is an investment in our people, and we will not be distracted by the naysayers. Yes, we hear them. I hear them. On one hand, they say we need another hospital here in the capital. On the other, they said that the hospital does not address the real issues for healthcare. On one hand, they say we need eye care services for persons with glaucoma, retinal detachment, and cataracts. And on the other hand, they criticize the more 700-plus Bahamians who had their eyes resolved via the Cuba Bahamas Medical Tourism Eye Project. But just last week, the people of Abaco benefited from the NGO Liquid Legacy and the World Cataract Foundation, where 100 cataract surgeries were successfully performed at the Marsh Harbor Mini Hospital free of charge. And I want you to look out for the Chinese government Bright Eye Cataract Initiative, which will begin in a few months. I spoke to the ambassador for China a week ago, and it has been confirmed that preparations are near completion. Mr. Deputy, I know the naysayers have their agenda, but I am here to report the facts. I intend to speak to the New Providence Hospital and the funding arrangement by way of the Chinese concessional loan facility, but I want to highlight the press conference a few weeks ago by the ambassador of the People's Republic of China, who led her support towards the New Providence Hospital by way of a loan by the Chinese Exim Bank. It's important to note that my ministry is currently completing the tender process for the new hospital site preparation, inclusive of additional geotechnical studies on the rock in the surrounding areas. Environmental clearance from the Ministry of Environment has already been given, but land clearance as well as preparation for the site will begin in short order. Details about the labor component of that arrangement will be finalized, and I assure you it will be completely transparent in this place and outside of this place. Mr. Deputy, my ministry is not simply managing systems and repairing infrastructure. It is leading a progressive movement. A movement to ensure that no Bahamian is left behind when it comes to health care. The record would reflect, for the first time in decades, we are making the investments necessary to modernize and expand our healthcare system, not just in words, but in action, in concrete and steel, and in the real access to modern healthcare services. Over the last 2 years, the recruitment of local and international healthcare professionals have intensified, and the training programs were introduced to better equip Bahamians and healthcare professionals in the country in our primary and tertiary healthcare settings. Policy and legislative reforms were implemented along with modern technological capabilities to bring healthcare systems into the 21st century. We sat with our unions and private partners, and although sometimes teeth cut tongue, we are still at the bargaining table, keeping the country's healthcare system in the forefront while we work out our differences. I truly believe that our healthcare system is on a clear path to modernization. Much work has already been done, but I am mindful and fully aware that we need to do more work. I now turn my attention to healthcare infrastructure, where over $500 million have already been allocated in just 4 years in office, proving that our administration is making the largest investment in healthcare infrastructure in generations. Many clinics across New Providence and the Family Islands have been upgraded, not only physically, but we are completing the necessary digitization steps and providing labs and diagnostics on every island. In a matter of months, my brothers and sisters in Andros, Eleuthera, Bimini, Cat Island, San Salvador, Inagua, Long Island, Abaco, and by extension Exuma, will also have the ability to have lab and diagnostics done in their island. Through our digitization program funded by the IDB, patients will be able to receive their results for blood chemistries, full blood counts, cardiac enzymes, prostatic-specific antigens, cholesterol, colon rectal screening, X-ray, ultrasound, and breast screening. This is huge, Mr. Deputy, and we are not stopping there. In the past 4 months, you would have witnessed the renovation and reopening of many clinics across the country, including the groundbreaking for the Coconut Grove Advanced Health Center, the new Mangrove Key Clinic, and the new state-of-the-art healthcare facility in Palmetto Point. Mr. Deputy, this is basically to really address what's going out on social media. They're saying we're breaking ground and we're not doing anything. This is the Coconut Grove Clinic that is presently coming out of the ground. And Halkitis was there. This is, you was there too, yes. Yeah, the MP and Halkitis was there.
Outgoing and incoming.
Yes. Yeah. Well, that's understandable. For now. This is the Mangrove Key Clinic coming out of the ground. This is the Palmetto Point Clinic. That's not just a drawing. It's coming out of the ground. During this budget cycle, we will finish renovating Inagua, Exuma, Long Island, Acklands, and break ground on a few smaller clinics across the country and complete our renovation of our 2 mini hospitals to ensure that we are able to provide extended services and urgent care services. Mr. Deputy, the Princess Margaret Hospital is the country's largest hospital, providing tertiary healthcare services for decades. This 70-year-old aging facility is more than a prominent hospital. It remains the training ground for many of our outstanding healthcare professionals and is home to the prestigious UWI Faculty of Medical Science and Clinical Research. At PMH, the long overdue expansion for the Accident and Emergency Department is now 90% completed and scheduled to be fully operational by the end of July. Multiple unforeseen change orders delayed full occupancy, and I want to thank the Bahamian people for their patience and support during this difficult period. Additional funding was secured in the midterm budget by way of the $75 million loan facility from CIBC for hospital upgrades to complete phase 1 of the Freeport Health Campus and begin multi-story concrete structure for phase 2 to begin now to show the hospital in full-fledged and the state-of-the-art hospital fully operational before the end of our term in office. Mr. Deputy Speaker, I am pleased to report to this honorable House that the tender process for the long-awaited renovation for the Princess Margaret Hospital Legacy Ward, inclusive of the I Ward, the I Theater, the PMH kitchen, the operating theater floors, furnishing and medical equipment for the Accident Emergency Department in both Nassau and Freeport is near completion, and the funding is in the $75 million. At the Rand Memorial Hospital, major renovations including the morgue facility, on-call quarters for doctors, the upgrade of medical infrastructure is 95% completed, and in a few months we anticipate full occupancy. The mold remediation exercise for the modular units to the east and west of the Rand Memorial Hospital facility is completed, and these units will go back in service in a few weeks. These units, when purchased, had some structural defects in the water supply, and when we initiated water to the units, some leakage took place within the walls, creating this problem with mold. Mr. Deputy Speaker, we are delivering on our promise to build a state-of-the-art Freeport Health Campus. Phase 1 of that project is expected to be completed by the end of the year. And this is a picture of the hospital coming out of the ground. We are getting ready for the EpiCore to pour the roof of this facility, and after that we'll begin to install the necessary windows and hopefully have phase 1A and 1B ready for turnkey by the end of this year, early next year.
You invite Marcos Lee, right?
Of course, he's always invited. In addition, the pre-qualifying bid documents for phase 2, inclusive of the multi-story tower and water and sewage treatment plan, will be released by the end of the summer. Following that, we will go out to tender, we will award a contract and start the construction of this multi-story reinforced concrete megastructure. On completion of this ambitious project, the residents of Grand Bahama will finally have a full hospital with oncology services, transforming healthcare on that island and by extension the northern services for years to come. Mr. Deputy, the expansion of mental health and geriatric services at the Sandilands Rehabilitation Center and the Department of Public Health is also a priority for our administration, and we intend to expand both inpatient and outpatient services across the country. In this year's budget, under Head 60, line item 228115, some $500,000 has been set aside to support integrated mental health services and community-based nursing projects for mentally ill patients who are displaying chronic symptoms, and provide teleconsultations for patients suffering from anxiety, depressive disorders. We have partnered with the Bahamas Psychological Association to assist with professional services, particularly in our family islands, now that some of the components of the new Mental Health Act is in force. A few months ago, 41 psychiatric nurses completed postgraduate training and are currently leading the charge in implementing many of the new mental health protocols that would prove to be a success and improve clinical outcomes. Meanwhile, funding is also set aside this year's budget for capital works to upgrade the Sandilands Rehabilitation Center, inclusive of additional bed space and equipment for the geriatric inpatient care. Many of you know, and many of you have relatives or know of relatives, elderly, who are suffering from dementia and the complexities of handling cases of that nature. These new extensions will be able to allow the hospital to bring more people inpatient to stabilize them while training and teaching family members on tools and techniques on how to handle the elderly. Mr. Deputy, I turn my attention now to manpower resources and training. A resilient healthcare system is only as strong as the men and women who serve in it. My ministry has placed significant emphasis on increasing and retaining human resources in the public health sector. We will continue to invest in Bahamian healthcare professionals and strengthen healthcare workforce in the short, medium, and long term. In the public health sector, the ongoing training and recruitment of nurses continue. 25 midwives are scheduled to sit council exam this month. 21 additional midwives started training in January 2025 and will complete in May 2026. 63 graduate nurses sat council exams last month and are waiting for their results before receiving appointment letters from the Department of Public Service after being vetted by the Royal Bahamas Police Force. So far this year, 114 nurses have been trained in management and leadership to take on supervisory programs in the Department of Public Health and the Ministry of Health and Wellness. Promotion exercises for nurses are ongoing and near completion. The nursing cadet program is ongoing, and 2024-2025 cohort completed the program last year. A total of 106 12th grade students graduated from across the country, and Of the graduates, more than 40 students are currently enrolled in UB Faculty of Nursing for the upcoming fall semester. By way of the PHA Academy, 32 students enrolled in the NACOB-approved Trained Clinical Nurse Program sat council exams last month, and they are waiting for placements at the Princess Margaret Hospital, Sandilands Rehabilitation Center, and the Rand Memorial Hospital. Training by way of local colleges. Tarif College in Grand Bahama commenced the ministry-funded Trained Clinical Nurse Program in January of this year, with 50 pupil nurses enrolled in that program, covered under line item 225-1108 in my budget for tuition, training, and in-service awards. Likewise, the Bahamas Baptist College University is scheduled to start my ministry's Trained Clinical Nurse Program early next month. 50 nurses have enrolled, along with 30 students who will be pursuing the associate degree in informatics and hospital digital information systems at that university. Mr. Deputy, local and international recruiting exercises continue to fill the current gaps at the Princess Margaret Hospital, the Rand Memorial Hospital, and Grand Bahama Health Services. We have 32 local nurses currently being vetted and ready to be hired. 30 nurses were recruited from Ghana that joined the 19 already in the system, and from my report, they are integrating well in the healthcare system in the Bahamas. 9 will be posted to the Department of Public Health to assist in our Family Island primary healthcare programs, and 21 will be deployed at the Princess Margaret Hospital. While in Geneva, I had a bilateral meeting with the Minister of Health of Ghana. We are in communication, and I'm pleased to report to this honorable House, through country-to-country recruitment, we are now in a better position to recruit specialty nurses to be deployed at both the Princess Margaret Hospital and the Rand Memorial Hospital. 10 Ghanaian doctors were also hired this year in the Department of Public Health. These well-trained physicians will join our team in the Family Islands. Local recruitment of graduate nurses to the internship program also continues, with 60 nurses tentatively joining the internship program on July the 14th, 2025. This ongoing initiative increases nursing workforce and aid in the recruitment of new registered nurses to fill the gaps in the system. Postgraduate specialty training for nurses continue, and we also recently trained 9 sexual abuse nurse examiners who will be deployed in our clinics and who will be deployed at our hospitals to really do all of the preliminary checks along with the Royal Bahamas Police Force in cases of sexual molestation and rape. Other postgraduate training anticipated to commence this budget cycle includes the Master of Science degree in community nursing, gerontology, administration, and education, scheduled to start September of this year, with 35 registered nurses already accepted in the first cohort. The recruitment of the Emergency Medical Service ambulance drivers by way of the Royal Bahamas Police Force is near completion. I want to thank you, Minister, for partnering with us for this essential need. And this initiative will assist my ministry in the interim, allowing 24 new EMT recruits to complete the PHA Academy 5-month EMT program, and on passing their certification will be deployed to our Family Islands. Of the 16 students in the first cohort at the PHA Academy, it's unfortunate, but only 3 passed their certification, and this left a hole in the system when my ambulances from Spain arrived in the country, and I had to reach out to the Royal Bahamas Police Force to assist me to implement the program and give me enough time for my new recruits to be certified. Mr. Deputy Speaker, during his budget presentation, the member for Kalani spoke about shortage of healthcare workers, particularly specialty nurses and doctors, which he knows very well is a global phenomenon. And we are recruiting and training local Bahamians to fill the gaps. But despite his claim of regional shortages of healthcare workers and in hospitals, we see throughout the Caribbean where hospitals are being built and expanded across the Caribbean. Our healthcare planners indicated that the construction and or purchase of new hospitals are necessary to address the current bed shortages in the system and to meet the World Health Organization mandate for pandemic preparedness and compliance of the new pandemic treaty recently passed by the World Health Assembly. In addition to manpower resources already mentioned, I am pleased to report that recruitment exercises have already begun for resident specialists to fill current gaps at our hospital, and we look forward to expanding the existing postgraduate program with the University of the West Indies on signing of the new heads of agreement with the Mona campus. We are partnering with universities in Canada, in the UK, Africa, Turkey, and India, and will give our junior doctors the necessary tools and in-service awards to study abroad or at home, but this time we will have well-structured bonded programs ensuring that our public hospitals are benefiting from the training and our taxpayers get value for money. Mr. Deputy Speaker, as we build our healthcare workforce, we continue to strengthen and advocate for the promotion exercises for our healthcare teams to take place on a timely basis. At the Ministry of Health and the Public Hospitals Authority, we need to strengthen our Human Resources Department to ensure that the priorities are set so our healthcare workers are not frustrated with their promotion exercises. I now turn my attention to union agreements. Mr. Deputy Speaker, in the health arena, the government of the Bahamas has signed industrial agreements left behind by the former F&M administration for our nurses, the Public Service Union, the Bahamas Doctors Union, last month, addressing key concerns in compensation and working conditions. And I have learned that our Consultant Doctors Union industrial agreement will be completed soon, and it will be behind us. And I'm certain that the member who is responsible for public service will speak to that agreement and give clarity of where we are and how close we are to completing that. Additional contracts have been executed by way of the Inter-American Development Bank for the retrofitting and upgrade of the National Reference Lab and the procurement of new vehicles, both aimed at strengthening diagnostics and surveillance capability island by island. And we will break ground very soon, Prime Minister, for the Stevenson Clinic on Cat Island. The tender process for the Moores Island Clinic is near completion, and shortly after, Black Point and the Berry Islands Clinic will be signed and executed by way of IDB fundings. I now turn my attention to my ministry digitization program. Mr. Deputy, logistics remain a significant challenge in managing healthcare systems across the archipelago. Modern medicine, modern protocols require modern IT systems. In 2024, we launched the Information System for Health Bahamas initiative, the most ambitious digital platform in effort to modernize our healthcare system in decades. This initiative is streamlining patient care, making patient medical records more accessible, and ensuring that Bahamians are not left behind waiting because of outdated paper-based systems. Since October of last year, 42 school health nurses, have digitally documented 11,000 student health encounters. And the Chronic Non-Communicable Disease Unit have recorded over 7,000 interactions through our digital platforms. In 2024, the Ministry of Health and Wellness launched the Bahamas EMR Plus system, a locally developed electronic medical record system. This technology is currently being piloted at the Gambia and Adelaide clinics, where we are testing how it enhances patient care, reduces waiting times, and ensures that we are in a better position to manage medical records, both in the Department of Public Health and at the Princess Margaret Hospital and the Rand Memorial Hospital. Feedback from both clinics have been overwhelmingly positive. Patients are now able to pay for services using credit cards and debit cards, making transactions faster and more convenient. We are launching a new digital platform for e-prescriptions, e-vaccinations, online patient portals, allowing Bahamians to book appointments, receive test results, and manage their health care from anywhere in the country. I am pleased to report that these innovative digital platforms will be launched in our public clinics before the end of this year. This initiative is also by way of IDB funding, and once implemented will improve efficiency, reduce waiting times, improve confidentiality, improve healthcare integration, and improve clinical outcomes. Mr. Deputy, the ministry will not be effective without legislation and policy reform. The Ministry of Health and Wellness, in collaboration with the Attorney General's Office and technical partners, continue to advance health-related legislation and policy reform. We are in the final stages of preparing a compendium of bills that I will lay shortly after this budget debate, including the new National Health Insurance Bill 2025, which will repeal and replace the existing NHI Act. This new bill will enable the formal transfer of the National Prescription Drug Plan from NIB to NHI. I want to thank the member for Port Charlotte because this is a piece of work that we have been working together as mandated by our Prime Minister to be able to take this plan that was in NIB and put it where it belongs with NHI. Alongside the NHI Bill 2025, there will also be the amendment to the Pharmacy Bill. And I will also lay a new bill, the National Insurance Chronic Drug Prescription Fund Act, which will also be tabled in the House of Assembly and repeal the current Chronic Drug Prescription Plan Act presently with National Health Insurance, with NIB. These legislative reforms are critical to expand the drug prescription plan, improve the procurement process, and reduce duplications in the system, and ultimately reduce wastage. Further, the amendments to the Pharmacy Act, coupled with the new cannabis seed-to-sale digital platform that will be the engine to manage the cannabis industry and help bring into force the medical cannabis legislation with the implementation of the cannabis e-prescription platform. So if we were to go back and look at the bills that were brought to this honorable chamber for the cannabis industry, you will see that in order for the industry to go, all cannabis prescriptions will be via e-platform and not written. That way, we would have better control to monitor and prevent the misuse in the prescription area. In a few weeks, we will lay the new dental bill, 2025, that would repeal and replace the current Dental Act and improve the industry, keep unlicensed players outside of our communities. I don't know if you recall, a couple months ago or a year ago, there was a young person in the community claiming to be a dentist and have no degree and was providing services to a wide cross-section of Bahamians. Wow. And so it's important now for us to strengthen this legislation to keep these imposters out and to keep unlicensed players from providing services which they are not licensed to do, but mainly to assist my ministry in expanding community-based dental services island to island. Yes. Mr. Deputy, additionally, in a matter of weeks, I intend to debate the Health Promotion and Wellness Bill 2025 that was laid in this honorable House in March of this year. This bill, once passed with an act and enacted, will establish the framework necessary for health policies on lifestyle modifications that would govern the work of my ministry's wellness unit. I launched my ministry's wellness unit in collaboration with the private sector and piloted by the Pan American Health Organization. Over the last year and a half, we have done many projects, and we realize that this piece of legislation that I will debate shortly will lay the foundation of how the wellness units will perform, how it would work in collaboration with the private sector, and how we would utilize the resources in the country in order to improve outcomes and begin the educational programs necessary to teach Bahamians the importance of healthy lifestyles. Through the work of our policy unit and planning unit, I will lay in this honorable House a white paper on violence prevention, using a public health approach as part of CARICOM's initiative aimed at stamping out violence upstream. I know we have a lot of programs for violence when the violence or the violent act is completed. But the reality is that if you were to do the evidence-based research, you will find out that many of the violent acts that were completed, there were signs and symptoms years before where individuals are living out these type of violent behaviors. The changes that will take place in healthcare reform is fundamental. And we will make good on our promise to reduce the burden of non-communicable diseases in our society in collaboration with my ministry's wellness unit. Our legislative achievements also extend to longevity and regenerative medicines, which is already in force. With established board and ethics committee and the launch of the state-of-the-art LATAR system, a very innovative digital platform. It is state-of-the-art. It is world-class. It's currently up and running and will ensure that the life-changing, lucrative industry with regenerative medicine not only survives in the Bahamas, but becomes profitable and becomes one of the drivers for the country's medical tourism industry. I now turn my attention to my ministry's renal transplant program. Mr. Deputy Speaker, many of my ministry's policies and programs are evidence-based, focus on reducing the incidence of non-communicable diseases in our country, which is consuming the large portion of my budget. It is actually taking up 60% of my bed space at the Renal Memorial Hospital and the Princess Margaret Hospital, and we must act and do something about it. Each year we see the troubling rise in the number of individuals requiring dialysis, a trend closely tied to the prevalence of uncontrolled diabetes and hypertension in our country. Mr. Deputy, end-stage renal disease is a growing public health concern, and 90% of patients on hemodialysis in the country, whether public or private, is completely underwritten by the taxpayer's dollar. The most effective treatment for end-stage renal disease is kidney transplantation and the medical control of the patient's underlying comorbidities. It reduces the demand for long-term dialysis and offers recipients the opportunity to live longer, healthier, and more productive lives. Mr. Deputy, I am pleased to report to this honorable House that after 2 years of preparatory work, my ministry's organ transplant program, funded by line item 228-1189 in the budget, is paying off and bringing forth fruit. Yes. Finally, the Princess Margaret Hospital is able to offer living donor transplants, bringing hope to these or those living with kidney disease. After much work in collaboration, I'm pleased to announce on June the 18th, 2 days from now, our lead consultants at the Princess Margaret Hospital, along with 3 distinguished transplant surgeons from Trinidad and Barbados, in the country for the 23rd Annual Caribbean College of Surgeons Conference, will perform a live donor kidney transplant on a Bahamian patient at the Princess Margaret Hospital. This will be a part of the official launch of my ministry's long-awaited kidney transplant program. This is certainly an exciting time in the Bahamas and for patients suffering from kidney disease across the country. It's been a long journey to get to this point, but thanks to our collective efforts and final preparations, the program will be launched this week at the Princess Margaret Hospital, led by 2 Bahamian specialists in support of some colleagues in the Caribbean. The country will learn more about this wonderful collaborative efforts over the next few days, foreshadowed by the Ministry of Health and Wellness a few years ago. I want to personally thank the Prime Minister for his personal support, because I remember the day when you met me in the office and spoke about this transplant program, for this life-saving program. And I know that the Prime Minister himself was scheduled to be a live donor for his brother, who died years ago from the complications of renal failure prior to the procedure being done. So it's a reality that hit home everywhere. And I'm sure the former member, Mr. Arnold Forbes, would not mind me saying, but he is also a recipient of a kidney from his wife. And so there's many stories throughout the country where we can look forward for Bahamians suffering from programs and be able to be a part of what we are doing. Mr. Deputy Speaker, this milestone is a result of timeless work by the Princess Margaret Hospital clinical team, including nephrologists, transplant surgeons, anesthetists, nursing staff, lab technicians, psychologists, social workers, and administrative personnel. Each played a role in preparing us for the successful delivery of this complex yet life-saving procedure. Let me be clear, Mr. Deputy. Kidney transplantation is not a simple medical procedure, nor is it a cure. It requires a lifelong commitment for patients and donors and the healthcare system. Post-transplant care, including rejection medication, is rigorous and requires strict adherence to medical protocols and medications. However, the reward, the chance at a renewed life, is immeasurable. Yes. To all potential and future living donors across the country, thank you for your selfless sacrifice, courage, and acts of generosity and love. Your decision to give life to someone who have no kidneys is remarkable and deeply appreciated. Kidney transplant now stands as a vital part, and I'm proud to say this, a vital part of our nation's response to reduce the incidence of end-stage renal disease in our nation, and along with medication, we will have better clinical outcomes, we will do a better job with screening, and we will reduce the incidence of chronic renal failure in the Bahamas. Yeah. Mr. Deputy, I'm winding down now. Before I take my seat, I would like to address 3 additional issues of public interest, and they are the Cuban healthcare workers in the country, the ministry's I program, the catastrophic care assistance program, and the need for the program to finalize the audits and bring the audits to the House of Assembly. 2 weeks ago, I went to Cuba to revisit the current recruitment protocols by Cuban healthcare workers in the country. You would recall that our Prime Minister and a team from the Ministry of Foreign Affairs had a meeting with the United States Secretary of State, Marco Rubio, to discuss the U.S. policies surrounding recruitment of Cuban healthcare professionals and teachers in our country. At that meeting, the member for Cat Island, Rumkey, and San Salvador outlines the country's need for Cuban healthcare professionals, for them to remain in the country to help my ministry address the temporary manpower shortages that exist in our healthcare system. These shortages are attributed to poor planning by former governments, FNM and PLP, and the extensive recruitment of Bahamian healthcare workers to countries to the north. To be completely transparent, today, in country, we have 3 Cuban ophthalmologists assisting with the Cuban Eye program. We have 3 Cuban nurses. We have 10 biomedical engineers from Cuba, 8 lab techs from Cuba, and 11 X-ray technicians that recently completed additional training at the Princess Margaret Hospital. The majority of these workers are scheduled to be deployed to the Family Island as part of my ministry's plan to provide lab and diagnostic services island to island. Mr. Deputy, significant investment has already been made in cross-training of these Cuban allied healthcare professionals, and the installation of lab digital diagnostic equipment is currently on the way, supported by some Cuban biomedical engineers working side by side with suppliers from the United States. Following discussions with the U.S. government through the Ministry of Foreign Affairs, my ministry negotiated new contractual terms with the Cuban recruitment agencies. After fruitful negotiations, we are prepared to cancel all existing contractual agreements and enter into a direct contractual agreement with Cuban healthcare professionals currently in the Bahamas. Those who agree to these terms will sign the new employment agreement by my ministry and remain in country for deployment across the Family Islands. Those who are not interested in this new arrangement will be given time to wrap up their affairs and return to Cuba. Currently, all healthcare workers in the country, including Cuban healthcare workers, receive the same benefits as Bahamian workers. They are treated well. They are respected in our country. We appreciate their services, and the agreement outlined in an MOU between the Cuban Embassy and the Bahamas government clearly articulate the need for that. All further recruitment exercises of Cuban teachers and healthcare workers are currently on hold pending the outcome of the ongoing discussions between the Ministry of Foreign Affairs and our relevant counterparts in the United States. In the meantime, my ministry will continue recruitment of specialist nurses and allied healthcare professionals from Africa, the Philippines, India, to address the short-term shortages that exist in the country and continue to train Bahamians to capitalize on these lucrative employment opportunities. Mr. Deputy, while the recent challenge with Cuban healthcare workers is a problem in the country, I am pleased to report that after the suspension of the Cuban medical eye tourism program, last week, the Cuban cataract and retinal ophthalmology program was reinstated. 60 Bahamians were flown to Havana for these life-changing surgeries, and on their return home, another 60 will go to Havana for surgery, and the program will continue as we reduce the waiting list for cataract and retinal surgeries in country. We are addressing the backlog from many different fronts, and I wish to thank Liquid Legacy and the World Cataract Foundation, both US-based NGOs, for performing 100 successful cataract surgeries at the Marsh Harbor Hospital a few days ago. They are scheduled to return next year to complete another 100 cases in Abaco, and at that time, launch a similar program at the mini hospital in Exuma including their new initiative, which is dental programs. Renovations will begin shortly by way of the IDB funding to accommodate that group and upgrade the Exuma Healthcare Facility for an urgent care facility along with 8 Mile Rock, South Beach, in order for us to divert some of the backlog at the Princess Margaret Hospital. Finally, we must not forget the Bright-Eyed Cataract Surgery Initiative by the Chinese government in collaboration with the Huan University School of Ophthalmology. This team of eye specialists will be in country in a few months to perform an additional 300 cataract surgeries at the Princess Margaret Hospital for patients who have other comorbidities and cannot travel. This initiative would complement the renovations of the eye theater and the eye ward and the equipment used by the Bright Eye program from the Chinese government will be left in the Bahamas for the newly renovated eye theater. All these programs are free for patients, completely underwritten by NGOs or by my ministry's catastrophic helpline. Mr. Deputy, during COVID-19, the Princess Margaret Hospital and the Rand Memorial Hospital was unable to provide many of the essential medical and surgical procedures needed because of the pandemic and the infectious disease component. The truth of the matter is, none of our public hospitals are designed to manage a pandemic. And as a result, many patients suffered and died because they were unable to receive the care they needed. This must never happen again in the Bahamas. That is why the newly proposed specialty hospital in New Providence will be EDGE certified, climate resilient, and designed with the pandemic preparedness protocols in mind. During his contribution, the member for Kalani spoke about his imaginary multi-story tower that he spoke about in his term in office. That was nothing more than a conceptual drawing that he and his Minister of Health presented to this honorable House few months before the last general election. The truth of the matter is, there was no plans. It was all talk. It was an election gimmick. And the funding by the Santander Bank was mixed up like conch salad. Mixed right up. So confusing that the Ministry of Finance could not get their bearing and had to send the money back to the lender, who instructed us to reapply. To be honest with you, the funding from the Bank of Santander that he keeps talking about for this multi-story facility was tied in with small loan facilities. And the question is, who got the loans? And so, rather than get in that conch salad, we decided to send the money back. I want to let the member for Kalani know that he failed to deliver. See, it's easy to talk, but he failed to deliver. And that is the reality that he must live with. So you can't stand on your feet and talk about plans you had and expect this administration to implement your plans. You had an opportunity and failed to deliver. But I want to make it clear on my feet. No, I'm speaking to Kalani. I wish he was here. Could you take that message back for me, Marco City? Because he took me to town when I was recovering from the flu. Mr. Deputy, through you to the Bahamian people, the Davis administration will deliver on our design plans, not Kalani's design plans, and bring to life what is documented in our blueprint for change. Mr. Deputy, I have visited many hospital construction sites in the Caribbean funded by the Chinese government, and built by Chinese contractors. That's the difference. I went to see them myself on the invitation of the former Minister of Health for Trinidad and Tobago, my good friend. A good example is the Arima Hospital, built by the Chinese. The hospital in Tobago, built by the Chinese. The multi-story tower expansion of the Port of Spain General Hospital, built by the Chinese and a company called China Railway Construction Company. They're doing work in Guyana. Guyana is building almost 9 hospitals, and he's talking about manpower shortages. Everyone in the world have manpower shortages. So we can't chew gum and walk. The workmanship that I saw as an engineer myself was structurally sound and good quality. And with the support of the former Minister of Health, the former Minister of Health for Trinidad, I met the owners' representatives for both projects who spoke highly about the quality of work. We intend to follow strict quality measures and protocols in the Bahamas and follow all building codes in our country under the watchful eye of my ministry's owner's rep. The secret with mega projects is you don't let people build them without your team watching them. So I have a team of engineers who will be watching every step of the way, watching the PSI of the country, watching every move to make sure the taxpayer get what it paid for.
So Bahamian workers are not going to be on site?
Bahamian workers must be on site, Marco City.
You should tell the Bahamian people that.
Yes, Bahamian people, Bahamian contractors and workers will be on site. It's mandatory. Mr. Deputy Speaker, give me a minute. Give me a minute. The latest negotiation financial terms for the New Providence Hospital is as follows. The total borrowed sum will be $268 million, $22 million less from the $290 million that was initially projected. The original sum clearly indicated that it was a part of the first feasibility study. This $22 million cost saving is attributed to replacing the coated steel structure with reinforced concrete recommended by the Chinese structural engineers hired by the XM Bank who reviewed the first feasibility study. The loan will be a 20-year loan package at 2% interest, inclusive of a 5-year grace period. Over the next 2 months, after discussions with the Ministry of Finance, we have presented a slightly different approach to the new hospital financing arrangement with the Chinese XM Bank. The Chinese XM Bank will be responsible for 70% of the financing project and to build the mega structure. The other 30% will be funded by the government of the Bahamas, either in the local financial markets or international markets. These financial details, final details, are presently being sorted out and should be completed shortly. I look forward for wrapping up these negotiations before the end of July and break ground on this much-needed hospital for New Providence. The labor component at that time will be fully disclosed to the Bahamian people. It will be disclosed in this place and in the public domain. Mr. Deputy Speaker, my ministry's catastrophic line item has been a lifesaver for hundreds of patients suffering from cancer, cardiovascular disease, eye disease, and orthopedic disabilities. Due to the demand on this government-funded program, categorized in line item 2251123, catastrophic health services in head 60 has been increased from 10 million to 12 million in order to help more Bahamians have access to these life-saving services, both at home and abroad. Just last week, my ministry assisted a child on one of the family islands, and to be specific, the Berry Islands, who needed neurovascular surgery brought on from an accidental injury. Yes, go ahead.
The chair recognizes the honourable member for Marco City.
I'd like to thank the member for Tall Pines, just for yielding. You were able to sign off on the loan with the Chinese Exim Bank in the absence of a heads of agreement that outlined the various dimensions of the program, inclusive of the labor component. I just found that to be remarkable.
We are in the process and negotiation, the final negotiations, which should be completed by the end of July. So how could you sign and you don't have all the factors? We are in the final negotiation stages and anticipate to sign off in July of this year. No money has passed any hands. I must let the Bahamian people know that on a weekly basis we receive letters of sincere gratitude from patients who benefited from this line item. This assistance by way of our catastrophic line item foreshadows what is about to come with National Health Insurance once NHI is fully implemented. Lastly, when the plan was initiated, I indicated that it will be fully audited. I'm pleased to report that the Ministry of Finance has initiated the process with the government internal auditors, and on completion, all of the necessary documents would be laid in this chamber and the upper chamber for complete transparency. Mr. Deputy Speaker, as I wind down, sound like a Baptist preacher now, as I wind down my contribution to this debate, after 3 years of negotiations with Doctors Hospital to lease purchase a 38-bed Doctors Hospital Harborside East Bay Street location, I'm pleased to announce on my feet that the Cabinet of the Bahamas has agreed to lease purchase of that new hospital at the appraised sum of $38 million to be paid in monthly installments over the next 10 years. The final details of this lease purchase agreement will be made public, and we intend to complete this transaction over the next 2 weeks. Shortly after, the Public Hospitals Authority will take possession of this new 38-bed hospital. This new asset will increase the much-needed bed space at our public healthcare system and make way for the upcoming renovations, scheduled to begin in short order, of the new dialysis unit at the Princess Margaret Hospital, and put in place the new elevated shaft that would collect the adolescents unit, the eye ward and eye theater, and the dialysis unit to make sure patients who are in intensive care will be able to flow properly for hospital dialysis. The new 55,000 square foot Harborside Hospital is fully operational. And ready to go. This is a picture of the facility. In halfway in its construction, I didn't have the most recent one demonstrating it's complete. This will be a part of the PHA. We are lease purchasing this facility from Doctors Hospital to add to our bed space presently available at the hospital. The new Harborside Hospital is fully operational and ready to go, with dialysis units, diagnostic and lab equipment, a fully operational kitchen, an oxygen generating plant, offices for staff, a gym, and many other outstanding rehabilitative care features. The negotiations were tedious, and I want to personally thank Dr. Charles Diggis from Doctors Hospital and his entire team, who worked closely with my ministry and the PHA and the Ministry of Finance during this entire process. We look forward to completing this lease purchase agreement, occupy this facility immediately, and continuing our partnership with the private sector. A lot of people don't realize, but healthcare in the Bahamas is private and public, and we need all working together in order to provide essential services for our people. Finally, Mr. Speaker, we are investing in people, facilities, systems, and policies island by island. Yes, we still have challenges in the system. We have challenges with the retention of our workforce. We have infrastructural delay because so many projects are going on simultaneously. And the logistics for delivering healthcare services across the country is still challenging. But I am encouraged by the resilience and dedication of healthcare workers and the overall performance of our staff in the public health system. I wholeheartedly thank the hard-working team at the Ministry of Health and Wellness. And I see I have some of my staff members here. I appreciate you coming. The new Director of Public Health, Dr. Swan. And then we also have Dr. Greenslade, who's responsible for our surveillance unit. And the one who was managing DPM, the 11 million tourists, to make sure we don't have no air, water, borne diseases. The Public Hospital Authority and the National Health Insurance. I also express my gratitude to our partners from the Pan American Health Organization, the Inter-American Development Bank, the Caribbean Public Health Agency, and local healthcare professionals, both in the public and private sectors. I remember when I was in doctor's hospital with COVID, with respiratory conditions. And the way how they took care of me at doctor's hospital is second to none. It has led me to have a greater appreciation for those who are in the healthcare system and the work they do. And when I was at my lowest, she brought hope, relief to me, and for that I'm grateful. Most importantly, I thank our frontline workers who continue to show up on a daily basis despite challenges. Yes. And serve the public with compassion, care, and dedication. I know we have some rotten apples in the system, but the whole system is not bad. I encourage all Bahamians to see the good, what is happening across the healthcare sector. Speak positive to it. And for those who have received excellent services from our healthcare facility, talk about it. It seems today only the negative voices are heard. And to our partners, we are so pleased that you have joined us in this transformative journey towards better health and wellness in the Commonwealth of the Bahamas. At the ministry, we are not perfect, but I know that we have thousands of hardworking, dedicated people who provide services from Inagua all the way to Grand Key. And this budget gives me the resources to continue my work as the Minister of Health to ensure that our brothers and sisters in the Family Islands have the same benefits and quality of healthcare services that we enjoy in Nassau or New Providence and Grand Bahama. Once again, I thank the people of Tall Pines for the wind underneath my wing to allow me to function in this capacity as the Minister of Health and Wellness and to live out a dream to assist Bahamians in every walk of life, irrespective of their socioeconomic or political persuasion, to bring them relief in their most vulnerable times. Tall Pines support this historic budget. I thank you.
Thank you, Honourable Member. Order that the documents do lie on the table. As many, the Chair recognizes the Honourable Member for St. Anne's.
Thank you, Mr. Deputy Speaker. Good afternoon, Speaker, Good Deputy Speaker. Good afternoon to members of the House. Good, decent, and the rest. Good afternoon to my constituents of St. Anne's, and good afternoon, Bahamas. I rise as the Member of Parliament for St. Anne's to give my contribution on the 2025-2026 budget in this long-existing and honorable House of Assembly. I spent the weekend doing my prep work, Mr. Deputy Speaker, for this contribution, and it was only this morning that it was perfectly put into context for me by one of the men on the outside that asked me to help him with some breakfast. He stopped me before I could get the money out of my wallet and said, "You know what, Mr. White?" I said, "What?" He said, "You know what I realized?" I said, "No, hurry up, it's hot out here." He said, "You know what Hollywood and the PLP have in common?" I asked, "What?" He said, "What Hollywood and the PLP have in common is they both love glitz and glamour, and they both make millions off pure fiction." Mr. Deputy Speaker, I told him, "You know, you're exactly right," and I couldn't have said it better. Pure fiction. We've heard and we're going to hear more about the Golden Yolk program.
Golden Joe.
Huh? You bought an egg on the shelf from the Golden Yolk program yet? Golden Joke.
That's right.
New hospitals. New hospitals. We just got an hour-and-a-half sermon from the Minister of Health, who at the end of it only acknowledged from a recent visit to Doctor's Hospital that he have an understanding of what people in the healthcare service go through.
All these years.
I mean, what kind of doctor is he, Mr. Deputy Speaker? Maybe we need to have an investigation of that. But no new hospitals are there. At the end of it all, we saw a converted red roof in, Mr. Deputy Speaker, that Doctor's Hospital has taken over a private facility, Mr. Deputy Speaker. But we're going to lease some of it under the Public Hospitals Authority.
38 million.
We're going to lease some of it, Mr. Deputy Speaker. Maybe we should lease another government in place of this PLP government, Mr. Deputy Speaker. We also heard pure fiction. We also heard pure fiction, Mr. Deputy Speaker, that BPL wasn't privatized. What we were sold today by the member for Elizabeth is that we essentially have a 4-story house with an outside laundry facility. And yes, we gave away the structure that has the 4-story house, everything that's operable, but we kept the outside laundry facility, and guess what? We own 50% of that now, but we've given away everything else to everyone else, Mr. Deputy Speaker, yet we're being sold that BPL wasn't privatized. We're being sold this story, pure fiction, Hollywood level, about a glass window bridge, Mr. Deputy Speaker. We've heard that for 2, 3, this is now the 4th year they're coming into it. This is an election year. They haven't been able to redo the drainage on Bay Street, Mr. Deputy Speaker. You think they're going to redo a glass window bridge in this administration? I say no, hell no, they're definitely not. Mr. Deputy Speaker, and we also now, I'm not sure if it was Chinese ambulances we got before or Indian ambulances we got before, but we got maybe 9 or more, and we're operating off of 2. And now we're being sold pure fiction about some Spanish ambulances, Madam Speaker. I don't know if they come with a side of tequila or what. Well, that's a Mexican thing, maybe not a Spanish thing. But honestly, 4 years, this administration is almost out the door, Mr. Deputy Speaker, and we're still getting pure fiction. So what of this balanced budget? I'm asking members to think about it. Just think about it. Just think about it. I want you to just think about the PLP has come into this House claiming they have balanced the budget and a budget surplus. They've even claimed that they were the first to do it since independence. The fact, however, is that they have not yet delivered a balanced budget, and even if they do at some date before they get voted out of office, they are not the first. They are not the first since independence, only the first since they introduced VAT. That's right, the first since VAT, that haunting VAT PLP legacy. When the PLP introduced VAT under Prime Minister Christie, It was such a shakeup to the Bahamian household expenses that they justified it by telling us that the VAT money would be used to pay down our national debt. In other words, there would come a point in the lifetime of our children and the future would not be burdened by a political lack of fiscal discipline. Before Christie left office, with Cat Island Rumkey and San Salvador acting as his deputy prime minister, the people were asking, where the VAT money gone? Remember that? Where the VAT money gone? The people were concerned. They didn't see the VAT they contributed to the public treasury being used to pay down our national debt. It was then they felt that they had been lied to by the Christie-Davis administration. Instead of seeing the debt go down, they saw the BAMSI building in Andros go up in a blaze and no insurance. Instead of seeing the debt go down, they saw the newly paved airport corridor get destroyed by a disgruntled road worker, a worker who had said he had not been paid. Instead of seeing the debt go down, the Bahamian people inhaled toxic smoke from continuous fires at the city dump. Then came the F&M administration, who entered as a new government that inherited a downgraded economy teetering on the edge of a fiscal cliff. There wasn't much investor confidence left. You will remember the last PLP administration's role in the Bahamar fiasco. A sitting cabinet minister writing the original developer directly and applying pressure for all the resort's expected brokerage business. Yes, there was more, but after that U.S. court ruling, some of the rest of those skeletons are currently before the Office of the Director of Public Prosecutions awaiting review. And it's possible that review will be completed before the still pending Michelle Reckley case. But let's not hold our breath, Bahamas. Not all possibilities are probable. The last F&M administration implemented prudent fiscal strategies and greater discipline. And despite the destruction caused by Hurricane Irma in September of 2017, all was on track to begin paying down the debt. All until Dorian destroyed the Abaco and Grand Bahama economies, and the global COVID pandemic shut down world tourism and trade. There was nothing left to do besides stoically move forward. One people united in love and service. Food programs were created with NGOs, and provisions for Bahamians families were rolled out earlier and with more efficiency than any of our brother and sister nations in the region. All civil servants were kept employed. Loss of Bahamian lives were mitigated through isolate-in-place measures, while diplomatic relationships were successful in securing vaccines to protect even more lives. Most of our people weren't financially capable to get on a private plane to the United States for private medical care, even though at least one member in here did. I'm going over all of this to make a point. The Davis-Christie administration should have already been paying down our debt. They should have delivered a balanced budget, and they did not. The administration was on track to do it, but for an act of God and a global pandemic, they could not. Now we're being sold a balanced budget projection by the Davis-Cooper administration. They are even trying to tell us they will deliver a budget surplus. If you believe that, it's because you are still comfortable believing what the Prime Minister says and can at the same time completely ignore what the Deputy Prime Minister says. One says surplus, while the other says tourism faces slowdown. It's all here, Mr. Deputy Speaker, in the press. Once again, another case of the Prime Minister conveying one message and the Deputy Prime Minister conveying another. They're playing good cop, bad cop with us, Mr. Deputy Speaker, to have our way with us. They want us to think it's going our way. But it is only their way, Mr. Deputy Speaker. Bahamas, if you are like me, you don't believe this Davis Cooper administration anymore. They are so arrogant and oblivious that they would still try to sell ice to an Eskimo knowing the Eskimo ain't buying ice. They are so arrogant they would boast of a housing program and just brush off complaints of rushed and shoddy workmanship. They're so arrogant they would ask the public to stop parking in the handicapped parking spaces while they themselves are parking in them without authority. Here, Mr. Deputy Speaker, you can see a post on social media of where a government minister's vehicle was parked in a handicapped parking spot. That caught the press's attention, Mr. Deputy Speaker.
Who was that?
That caught the press's attention, Mr. Deputy Speaker. And what struck me with disgust was the fact that this minister actually works in the same ministry of the minister saying, don't do it. Arrogance, though, Mr. Deputy Speaker, caused that minister or assistant minister to do it. They are so arrogant, Mr. Deputy Speaker, they would pull back on social service aid, claiming they are focusing on the people in real need, the people sleeping on cement floors, and at the same time simply announce there is a rise in mothers prostituting their daughters for payment of household bills. That's correct. Remember that shocking description of life under the Davis Cooper administration? There are a rising number of mothers exploiting their daughters in transactional sex for household bills. I'm not for that, Mr. Deputy Speaker. I'm not for the PLP. Remember what happened this weekend on Sunday? On Sunday alone, and the Father's Day at that, at least 5 men were shot in 2 separate incidents, and 3 have died. One, a senior officer within the police reserves. I am not for that. I am not for the PLP. They are so arrogant that they would tell you that they are taking a review of incidents in the police force so serious that they are creating an independent commission of investigation. And then months later, when they think the public concerns have cooled, only allocate $30,000 for operation of the commission. 30 grand. That is enough to cover $2,500 a month in rent and nothing more. They aren't serious, but they want us to buy what they are selling. I'm not for that, Mr. Deputy Speaker. I'm not for the PLP. Before I go further, let's talk about this alleged surplus. A well-respected Bahamian professional said he doesn't see where the money for the surplus is coming from. What have you heard? Have you heard we are getting it from the carbon credit money? I haven't.
Zero. Nothing.
What have you heard? Have you heard we're getting it from increased stopover visitor money?
Not at all.
I haven't. Sometimes when arrogant people try to sell you something you no longer are interested in buying,
Yes.
you have stopped listening because of what you've seen.
Tone them up.
Bahamian icon Nadi Zeneklayaka said it best on his recent episode of The Coldest. You follow Nadi Zeneklayaka, Mr. Deputy Speaker? This is the end image of his episode of The Coldest. Nadi said, where's the surplus? The people can't see a surplus, Mr. Deputy Speaker. They can't see a surplus. They can't see a surplus, Mr. Deputy Speaker. What the people do see, Mr. Deputy Speaker.
You mean help you?
No, I'm good. What the people do see, Mr. Deputy Speaker,
He's good. We got him. We got him. He's good.
What the people do see, Mr. Deputy Speaker, is a surplus of cruise workers,
Yes.
foreign cruise workers, a surplus of immigration and unemployment issues,
Yes.
a surplus of violence against women and children, a surplus in the demand for the freedom of information, a surplus in consultants, a surplus in potholes, a surplus in poor health care, a surplus in improper ambulances, a surplus in soup lines, in rising poverty, and a surplus in BPL load shedding, a surplus in cronyism, and a surplus in no-bid contracts. So where, oh where, is that surplus money coming from, Mr. Deputy Speaker? So where, oh where, is that surplus money coming from, Mr. Deputy Speaker? Well, it's coming from VAT. It's coming from tax.
Yes.
Let's go to the book, the budget book that is, Mr. Deputy Speaker. I've got all my budget books here right now. They're the cornerstone for my board, so I'll leave them there. Let's go to the budget book, though, to see what's happening with VAT under this dry your tear from your eye administration.
Yes.
In the supplemental budget estimates of revenue and expenditures for 2021 and 2022, okay? Supplemental budget expenditures for 2021, 2022. That was the first thing this PLP government had us doing after they won the election. In those estimates, now these are the estimates before the PLP introduced the VAT trick gimmick. In those estimates for the supplemental budget of 2022, the VAT to be collected before the PLP's VAT adjustment trick totaled $925,987,748. Almost 75 million less than a billion. In the budget book, after the PLP VAT adjustment trick to change the rate of VAT to 10% on everything, the VAT collected rose all the way up to $1,135,805,883. That's a total increase, Mr. Deputy Speaker, Bahamians at home. That's a total increase of $209,818,000 off the backs of Bahamian taxpayers. They told you they took VAT down.